Australia is facing some of the biggest crises in a generation. An ongoing pandemic, soaring debt, skyrocketing cost of living, climate collapse and global instability. It's a tumultuous time and presents a massive challenge for a government just 2 months into the job. It started with a bang. The newly minted PM on a whistle-stop global tour tending to critical business.
I have not had a day off for a very long period of time.
On returning to Oz, Albanese's found himself in a fairly flammable situation. The current COVID winter wave set to be our worst ever.
If you look at the hospitalisation rates of yesterday, we are rapidly approaching the highest hospitalisation rates throughout the pandemic.
The PM sticking to his guns despite growing calls for tougher measures.
They know Australians don't want mask mandates, but at the end of the day, they've got to step up and protect the community.
We listened to the advice from the Chief Health Officers. They wanted to encourage mask wearing where it was appropriate.
Hear that? That's the sound of a cost of living crisis. And from petrol to power to groceries, we're nowhere near out of the woods.
This inflation problem is going to get worse before it gets better, but it will get better. It will moderate next year.
Which brings us to the RBA, the Treasurer with one eye on the sledgehammer subtle approach to curbing inflation.
They can't deal with the whole challenge just by jacking up interest rates.
And today he confirmed an independent review of the Reserve Bank, the first in decades.
My focus is primarily forward-looking, and I don't want this to be all about taking pot shots at the Governor or the Board.
Not exactly a show of confidence, but next thing you know, Governor was also backing a review.
It's entirely appropriate for the government to take stock of Australia's monetary policy framework. It's something that we welcome.
And we haven't even gotten to the catastrophic State of the Environment report, the $1 trillion national debt that Labor inherited, or the looming global recession.
Fantastic. Yeah.
Talk about a baptism of fire.
This is fine.
Would you please welcome Prime Minister Anthony Albanese. Welcome to the desk.
Great to be here.
Obviously, there's a lot to jump into, but I want to go back to election night when you became Prime Minister. Was there a switch that goes off when you go from Elbow to Anthony Albanese, Australian Prime Minister? And was it before or after you were photographed in your pyjamas getting the paper?
Well, the pyjamas incident was one that was not my highlight of the post-campaign. That was when you realised things had changed, because that was like at 6 a.m. in the morning. There weren't normally photographers outside home at Marrickville at 6 a.m. I had something on just after 7, so I didn't even know it had happened. So
did your partner Jodie have to remind you that you are now the Prime Minister?
Well, I have to remind myself, I've got to say, when I sign letters and things and Prime Ministers on the top there, and when I'm watching TV sometimes and they say the Prime Minister today said, and I'm used to grumbling about that, and I go, oh, that sounds all right. Oh, that's me.
So you approve of the current Prime Minister?
I do. 100% satisfaction
so
here.
far, yes. We'll see if that holds. So let's get to the big issue right now is COVID.
Yeah.
Terrible day. I mean, hospitals are full, 90 deaths today, so that's the most since January, and we can only expect that number to get bigger. We're now seeing, and we have seen over the past few weeks, state health officers have been recommending work from home, and they've been recommending mask mandates, and state governments, especially we've seen this in Victoria, have decided not to take that health advice. Are you comfortable with states acting contrary to health advice they're given?
Well, that's not quite right, Wally, with respect. The AHPPC, the body of all the state health officers, reports into Professor Kelly, who's the National Chief Medical Officer. And what he says is that there's agreement on uniform going forward, that it's recommended that people wear masks when they're indoors and where they can't separate. And that's what we've been out there saying and advocating very strongly. It's a matter of getting the measures right. We know that we've got to get the health measures right, because unless you do, the economic outcomes will be worse anyway. So we've been following the advice.
We've seen the advice in the paper today from Victoria, and it is different to the government's policy.
Well, from state to state, there's 6 states and 2 territories. What I'm talking about is the consensus that's there at the national level, which is my responsibility. Professor Kelly says that his advice to us as late as Saturday when we had a national cabinet meeting was to encourage people to wear masks. Part of the issue here, I know speaking to the New South Wales Premier last week, is that there's mandates for masks on public transport, but only about half the people are actually doing it. Now, do you get on the trains and buses and arrest people or fine people for not doing it? We need to make sure that we do spread best practice, and by and large, Australians have been magnificent during this pandemic. They have made sacrifices. They're continuing to do so. We've had 116,000 people, as of this morning, had got antiviral treatment. We've had, in the last week, over 500,000 Australians have got their fourth shot. So people are going out there and doing the right thing to protect themselves and their families
People
and their
are
communities.
Tired. I do feel like there's
Yeah.
trust issues at play here. Like, I feel like more and more you're hearing people not convinced whether some of these decisions are politically motivated or based on health advice. And the thing is, we're not through this pandemic, and you can only get people to comply if they trust the decisions that are being made. And I feel like at the moment people are like, you were okay to mandate at one point, now mandates aren't happening. What's actually at play here?
Yeah, well, there's two things at play. One is there are mental health considerations that the health officers are bearing in mind as well. The imposition of controls on people's behaviour has an impact on people's health. That's just a reality. And particularly young people, we're seeing an increasing, a really problematic increasing in incidence of really severe consequences when it comes to young people's health, but others as well. But the second thing is that the big difference between now and, say, a year or 18 months ago is the level of vaccinations which are out there. That is making an enormous difference, so that whilst the numbers of people who are getting infected by COVID are expected to peak in the coming weeks and then go down towards September, which is the recommendation why we reintroduced the paid pandemic leave till the end of September. The consequences are less in terms of because if you're vaccinated, you have a level of protection which is there. And the other thing that is kicking in is antivirals that do make a difference if people have got COVID.
The other issue a lot of people are worried about is obviously cost of living, petrol prices. People are experiencing slightly cheaper petrol prices because the Morrison government cut the tax, not that it feels like it's cheap.
Yeah,
you've decided...
Certainly not.
No, you've decided not to continue that. Why that decision at a time when that's such a big thing for people?
Because we simply can't keep all of the emergency measures that we'll put in place as temporary measures there forever. We can't just continue to do that. We've got $1 trillion of debt. And, of course, petrol prices, in part, as a result of what's happened with Russia's invasion of Ukraine and the consequences that are there for that. But that's also having a knock-on impact on inflation as well because of supply issues and the supply chain. So if you increase petrol prices, you increase the delivery prices of food, and people are seeing that in their supermarkets. We recognise people are doing it really tough at the moment. We're not trying to gild the lily about that. But we're also not trying to say we can just keep spending money indefinitely, because at some stage there are consequences of that as well, and you have to make choices about that. We have a whole range of things that we want to do that we're committed to, like cheaper childcare and other reforms, increased funding for aged care. We need to cover that off. You can't cover that off if you just keep these temporary measures in place forever.
It's been nearly 2 months and still not a single spill, which is amazing in Australian politics. Have the faceless men introduced themselves yet?
Well, I think that what Australians really want is just a government that just gets on with governing. They've got conflict fatigue with people yelling at each other. They want to see less arguments internally as well inside parties. My team are very united. We have a very clear agenda going forward. It's not easy.
They introduce themselves?
It's not easy. It's not. Well, how would I know given their faces?
Yeah. You can tell they're the ones who turn up who don't have faces.
Lots more to chat about for another time, but PM, thanks so much for your time tonight.
Thanks for having me on the program.